Roll up your sleeves to prevent the flu.
Now more than ever, we need to protect ourselves so you can remain.
Yeah, like the public service announcement says, it's time to roll up your sleeve. All of the area's healthcare systems and their partners are coming together to create Vaccinate St. Louis. And joining us this morning is Dr. Trina Blythe. She is a pediatrician at Way to Grow in O'Fallon, Missouri. Good morning to you, doctor.
Good morning.
Now, this push is to get everybody a flu shot, and it seems like a very big job. Why is right now so important?
Well, September and October are the best times to get your flu shot because that will provide you with 6 months of protection against influenza, and we are already starting to see some cases of flu.
Now, if we get it now or say within the next couple of weeks, is there a chance the shot will, I guess, wear off as we get into like February and March?
Well, you usually get about 6 months of protection, and usually by late March, early April, influenza circulation is much lower.
Who should get the flu shot?
Everyone 6 months up and older should get the influenza vaccine, and especially those with chronic medical conditions like diabetes, asthma, or heart disease. Young children should get the influenza vaccine, and pregnant people and our older citizens, those 65 and up, should get the influenza vaccine.
And of course, we've been talking about COVID-19, the pandemic, which is upon us right now. Is there a chance we can have the flu and COVID at the same time?
Yes, viruses don't take turns. So you can be infected with both. So you want to really reduce your chances of having both of those infections at the same time, because anyone who gets infected with both influenza and COVID-19 is much more likely to have a severe outcome.
And is there any way to indicate what strain is coming? I know oftentimes we're able to kind of forecast that to know what's going to be hitting us here in the U.S. Any idea what it is or the severity?
Usually those who make the vaccine monitor the strains as they're circulating around the world, and they start making the vaccine for the United States based on a sampling of what's been traveling already. I have not heard any predictions as to whether it will be a more severe flu season, but given what we've already been seeing with 2020 and how it's sort of been a bad year, I would expect things to be at least as bad as in the past.
Any chance there might be a shortage of vaccinations in this area?
Unfortunately, I'm not seeing a lot of patients who are taking up their vaccine opportunities. You know, we're offering the vaccine at our office all the time, and I'm not seeing patients taking out advantage of that opportunity as much as they should be. So I'm not thinking there's going to be a shortage of flu vaccine.
All right. Well, we'll see how it goes. Thank you so much. We appreciate your time this morning, doctor. And if you would like more information on Vaccinate STL, we will have a link on our website, our Fox 2 mobile app as well. Thank you so much, doctor. And of course, you can get flu shots pretty much anywhere, your local pharmacy, your doctor. You can find them anywhere. Time to take a break. We'll be right back.